Back in July, the governor released guidelines for visitations at nursing and long-term care home facilities. Now, 3 months later, he's easing up on those requirements.
The biggest change in looking at the regulations as announced yesterday as to what we were doing in the past was if you have a positive case, you used to have to wait 28 days before you could allow visits again. And now the governor has changed that to 14.
The facility must also provide enough staff for housekeeping, dietary services, and direct care. Facilities with a positive case can still have visitors on a case-by-case basis, with a doctor recommendation if a resident develops mental or physical disabilities from separation, which Riga says they did see in some of their residents.
We did see a lot of issues with our residents that were feeling lonely, feeling depressed, and the visits have helped. It makes all the difference in the world to someone who's been quarantined for months and months.
Each person, including staff, volunteers, and visitors, must be screened before entering the facility. They also must restrict entry to anyone that does not pass the screening requirements. Riga says they follow all requirements set by the state and CDC and remind people if they want to enter, they must wear a mask. Facilities must also have an adequate supply of PPE. Riga says these requirements are now their new normal.
This is the way that we're going to have to operate. I can't see us going without masks. It's just smarter to be safer.
Now, Riga says he applauds his staff for remembering what they do outside of work could determine if they unknowingly bring a positive COVID case back into the facility. For Northeast Arkansas News, I am Sarah Doan in Jonesboro.